Well, good afternoon. We're going to launch the session. My name is Tony Giavento. I'm the Executive Director of CHOA, and our team, our staff have been looking through the guides that come out of different municipalities, that come out of the health authorities, the provincial government, the medical health officer, and we've been trying to distill this down to a simple, easy to understand series of concepts and assessments to make it easier for you, strata councils and property managers, to figure out, can we open the pool? Can we open our facilities? What about our guest suites? What do we do about Airbnbs? How do we access units for maintenance and repairs? And it's all about opening back in a more traditional sense with all of our properties. So I'm going to cover all of these. We're providing you with an additional number of guides and materials that will be posted to the website. And we're putting together a longer detailed guide for strata councils in assessing each of these different types of facilities. But if you're like me in the hundreds of pages of documents and guides, and some are protocols, some are guides, some are best practices, some are actual requirements, trying to pull these all together has taken an enormous amount of time. And I don't think anyone is still 100% clear on what those expectations are. A note of thanks to Associa Management, who is our webinar sponsor this week. We really appreciate the support through the business members, which is helping offset all of the costs for these programs. This webinar is recorded, so if you submit a question through Q&A or publish a chat comment, everyone participating in the webinar will be able to see your question. Your questions will not appear in the recorded version of the webinar, though, unless your question has specifically come up. For your protection, do not identify your strata plan, your business, or any personal information during the webinar. General information is definitely helpful. And we'll hold questions to the end of the presentation, at which time the recording will end, and I'll stay live to answer some questions for a bit. The other thing is the first 15 questions that I've seen already are being answered through this webinar, so that might help to resolve that for you as well. So 3 key factors that we're going to look at. One is understanding your obligations as a strata corporation, and I think there are some misunderstandings out there with respects to what your rights, duties, and obligations are. The other is, of course, protecting public safety, and this is the safety of your residents, those people who transit through your strata corporation on a daily basis, service providers, contractors, protecting the safety of employees. Your duty is very high when it comes to employees who are on site. And then, of course, understanding the difference between an employee and a contractor may not change those conditions under the current safety requirements. So what is a strata corporation? I think everyone needs to remember this. Whether you're a duplex, a 2-unit strata, or a 1,200 unit complex, you are a legal entity. Strata corporations can own or sell property and assets. They can mortgage property. They can employ staff and contractors. You can be sued. You can sue other parties. You must insure buildings and assets that are the responsibility of the strata. You must file an annual tax return. So a strata corporation is essentially that has the same capacity as in an individual person or a company, and may do all of these same functions of business. You also have the same liabilities. Smaller strata corporations often function as self-managed and often as self-maintained entities. However, at some point, every strata corporation is utilizing contractors and service providers, whether it's someone to clean the gutters, whether it's an arborist on site dealing with trees for you, whether it's an emergency response from an insurance restoration perspective, if it's a flood, if it's an inspection of your buildings, if there's a safety requirement. At some point, every strata uses a contractor or service provider. And for this reason, every strata has to provide with the provincial regulations and the regulators. You are not an exempt private property. I hear this often. Strata corporations often say, well, you know, we're private property. We'll do essentially what we need to do, and we don't really have to comply with these other requirements. That's not true. You are subject to all of the other conditions that are imposed through WorkSafe, through Technical Safety BC, through local government bylaws, provincial statutes, and any orders that are issued. So strata corporations and strata councils specifically need to be aware you have the same duties and obligations as many businesses. Think first of yourself as a business when you're making these decisions around openings, when you're making decisions with respects to use of property. Here is a kind of a short list of what regulations apply. There's certainly more. What I did not put on here is, of course, is the BC Residential Tenancy Act, because you, the Strata Corporation, unless you have a tenant, you, the Strata Corporation, are not directly involved with tenancies between owners and their tenants. But all of these other regulations apply. WorkSafe BC is paramount because through employees, or through service providers or contractors, you as the Strata Corporation are always the last line of defense. It is your responsibility to ensure a safe work environment, and definitely through COVID-19, the safety of the employees is paramount. Technical Safety BC is another area. We'll look at these closely, but Technical Safety BC is also another area of regulations that will be applying. Provincial orders such as the COVID-19 enactments apply to your strata. Regional health orders that may come out of your regional health authorities, and there are 5 of them in the province. Local government orders, pool regulations, BC employment standards, all of these regulations apply to you as strata corporations. Under WorkSafe, it's the obligation of your strata to ensure the safety and the protection of your employees. WorkSafe have published some very, very helpful practice guidelines to basically assist strata corporations in understanding what their duties and obligations are. If you retain a contractor, however, and that contractor comes onto your property to clean your gutters, prune a tree, wash windows, change a front door, and that contractor is not covered under WorkSafe, in the event there are problems, there is an incident, you, the Strata Corporation, will be held responsible. So as a Strata Corporation, we recommend you register, establish a WorkSafe account so that you can ensure that you have coverage for any of these general contractors that come onto your site. Of course, the other thing you can always do, which we recommend, is screen contractors before they're on the site and go to the WorkSafe BC website and just check the status to ensure that they are in fact active contractors and have an active account with WorkSafe and in good standing. Can you ensure social distancing for the protection of your staff and work locations, such as a front desk, on-site office, or a recreation facility? In many buildings, like my building alone, we have full-time concierge on the front desk. It's a very large building. All of our parcels and deliveries occur to the front desk. Our security is managed through the front desk. So we've had to deal with things like social distancing, barriers, spacing to be able to access the desk, how parcels are handled that are delivered. And if they're not food parcels, they may be held for a day before they are then passed on or handled to another party. If they're food parcels, there is a direct relationship with food recipients where they come to the entry to pick them up in a designated area. Now, all of the protocols are managed to ensure that our staff can work in a safe staff environment. And these are some of the things that we deal with. And in strata corporations, the space between reception areas and offices is often not that large. So physical distancing may be difficult at certain times. Again, things that you need to look at when you're dealing with this. The other thing that occurs with staff is on-site staff are frequently also required to double up if you have swimming pools and hot tubs to do testing on a routine basis. So there are going to be a significant number of interactions between staff and high-touch surfaces if those facilities become open. Again, another thing to look at when you're looking at location and contemplating opening up any of your facilities. Have you provided your staff with personal protective equipment? Have you provided them with masks, gloves? Do they have access to sanitization equipment and cleaning products? Do you have a plan for frequent cleaning of shared workspaces and high-touch surfaces? And this includes areas such as elevators, entry doors, emergency entry and exit doors, the access to your office area, the access to public washrooms if you've left them open in your building, and what the cleaning protocols will be around those. Is a physical barrier necessary for the protection of your staff? And in going through this, it's mindful to understand that staff or contractor interaction is going to happen with respect to opening up pools, hot tubs, gymnasiums, meeting rooms, and any of your other facilities that you may have. Do you have a work plan to manage confirmed or suspected cases of C-19? So if you do have an outbreak or you do have an issue in your building, Do you have a work plan for your staff? What happens if staff have to leave for sick leave or for support for a family member? What happens if a family member has tested positive for C19 and then they have to leave the workplace for a period? Do you have a plan for those? Do residents, contractors, and service providers interact with staff? And have you developed a visitor policy for this? It's one of the things that we've discovered in a number of buildings, that owners are still doing routine remodeling, such as painting or changing a carpet or something like this in their buildings. The service providers coming in, the contractors coming in, seem to have very little protocol when it comes to managing their own C19 risks and their interaction with those communities. And certainly I've seen firsthand where contractors who are coming in to paint a suite have behaved as if nothing had changed. They had no protective equipment. They didn't understand the protocols of our building. They didn't understand what the interaction with the people in the building was. So, you know, there are a number of conditions that occur even with outside contractors coming into the building. A visitor policy for contractors coming and going would be beneficial if you have some way of tracking that. Another issue that comes up is if you developed a policy for Airbnb, which results in transient occupants. Even though we have a hold on traveling and vacation at this point, which may be opened up, there are still a significant number of people in BC and Alberta who are crossing the border, who are accessing Airbnbs or their vacation properties, and they are essentially transient occupants. Is there any screening to be able to identify who these people are? Do they have visitors with them? Are there gatherings that are involved? It gets more complicated to manage. It places your residential community at higher risk if you're not managing it, and the potential of transiency and transmission creates higher problems. Technical Safety BC regulates boilers, elevators, gas-fired systems, hot water tanks, makeup air units, and gas fireplaces and units. You do require regular inspections and certification of the systems. And so again, here we have a service provider coming into our buildings, maybe going to our swimming pools, our hot tubs. We have a number of units within our properties that are going to be regulated through Technical Safety BC. There have been a number of extensions that have been issued on inspections and orders, and Technical Safety BC have been incredibly cooperative in helping Strata corporations get through this. But here's another line of individuals interacting with the Strata Corporation that will certainly have an impact on whether you do or don't open or do not open systems. Provincial orders such as COVID-19 enactments and orders issued by the Chief Medical Health Officer totally apply to Strata corporations as they do to all people in British Columbia. But for Strata corporations, you need to look closely at what that means with respect to opening facilities. So phase 2 implementation is in effect as of May 19th. And what that means for us is that we now have other types of permission allowed, with the potential of having some facilities open. Regional health orders issued by one of our health authorities. There are 5 of them. You'll find links to them directly on our website. But look at the guides and the information that's been provided by Island Health and Interior in the Interior Health Authority. They're both excellent guides with respect to opening facilities and management. Local government orders and bylaws, look closely to the City of Vancouver orders, any conditions around facilities or public facilities. And these all lead into things like pools. So the pool regulations, and here's an eye-opener for many Strata corporations, but a Strata corporation of 4 or more units with a pool or a hot tub must comply with the provincial pool regulation under the Public Health Act. You are deemed to be a commercial facility. Pools and hot tubs are deemed a commercial pool or a commercial facility. So you must comply with all the regulations for use, maintenance, and operations, and they must be followed and are subject to the same protocols and procedures as commercial pools that you would find in a hotel, in a health club facility, or any other public space. It comes as a surprise to many Strata corporations that they suddenly, were a townhouse complex of 48 units with a pool is suddenly having to run and manage and maintain their pool like a commercial pool. And the standards are substantially higher, but it is intentionally there for the public safety. The important thing to remember about the pool is that many people simply react as if it is their own pool and don't put into consideration what the occupancy is. The facilities that are used, such as change rooms and showers. You know, I always joke about why we ever have a sign up that says you must shower before you enter the pool or the hot tub. If you spent a day by the pool watching what's going on, you'll find that very few people ever shower before they go into the pool or the hot tub. If that is the status, what are the odds that anyone is actually going to comply with any type of self-administered social distancing or sanitation or anything else that's for the benefit of the community? It may not be economically possible, or it may not be in the interest of the Strata Corporation to open your pools or your hot tubs given the conditions that have to apply. A Strata Corporation's first priority is to protect public safety in this case. So when assessing the use of a gym, your recreation facilities, your pool, your hot tub, saunas, we have club rooms and guest suites, meeting rooms, public washrooms, change rooms, public kitchens, lounges. Evaluate the use on the final objective. Can we assure public safety if this facility is opened? So look at all of the potential users. You will obviously have residents. Are you going to limit this only to residents' access? If you have Airbnb or vacation users who have vacation property, are they going to have the same access to all of the facilities? If they're owners of property, there isn't really any way of preventing that. And when you take the list of all of the potential users, the interaction with the staff, the cost to be able to properly manage and maintain the facilities, and the protocols for cleaning and cycling, you may suddenly come to the reality that it really isn't worth it. The other challenge, of course, is the social distancing requirements. Whether you're in a club room, whether you're in a lounge, or you're in the hot tub or the pool, the social distancing requirements still are the same. Can you still manage the same social distancing requirements to ensure public safety? Can we ensure safe distancing of 2 meters between all parties? I think this is one of the elements that we step back and we look at. And I have a little formula to show you around that helps you to really put this into perspective of what social distancing in gatherings looks like. Can we maintain cleaning and disinfecting protocols after each use to protect users? So our gymnasium, we'll have running machines, we'll have bikes and rowing machines, and weights and other types of uses. Do we have a protocol for cleaning those facilities every time someone has been in there and used them? If you were leaving it up to the random volunteer use of individuals to spray and wipe down their own bike or facility they used while they were in there, do they competently know what to do? Do you have signage? Is there any screening that is of the users who are going into the pool, the hot tub, or into the facilities to determine if they have any symptoms, COVID-19, or have come in contact with someone who has COVID-19? Are you retaining a record of the users in the event there's an outbreak and users need to be contacted? So, you know, it's not just a matter of we'll open the pool, it's going to be easy. There's a very long thread of obligations that interact with staff, that interact with contractors, the safety of the residents who use the facility, and then of course an obligation that if there is an outbreak and it's traced to your complex, is there a method to be able to contact everyone? The health authorities certainly get involved at that point and they take control of that. You don't breach confidentialities. That is your next line of defense, is the health authority. But at some point, if and when this occurs, you need to have a protocol in place. Again, public safety includes our employees. Have you educated the employees on the safety measures necessary for their protection? Swimming pools are a very interesting dynamic when it comes to employee safety. A number of pools have been left dormant. To save money, people have stopped heating them because they don't know when they're going to be opening, which is, we totally agree. Many have been left dry for the winter because they just simply haven't been refilled. But a pool that has been left dormant and gone stagnant and hasn't been treated under the same chemical protocols has a very high risk of Legionella, and we've had outbreaks in the province. And so again, when the pool is being restarted, when it's originally being cleaned, there is also a requirement for protection of employees of the protocols of how that restart may occur to prevent Legionella? Have we provided our employees with all the protective gear they need to interact in these facilities? Do they understand what their level of interaction with residents may be? Another important factor to look at. Does your strata permit Airbnbs? Airbnbs aren't just going to be about individuals who are transient coming into the building, but if you've opened your facilities and your pools, your hot tubs, and your gyms, you may have accessibility issues that you'll have to deal with it at that point as well. Have you established any screening protocols for the use of facilities and visitors? When you look at the numbers, it's a small number of people who will probably be able to use the facilities at any given time. And as a result of that, you're going to have some sort of screening protocol just to ensure that they are using the facility safely and that they have none of the symptoms related to COVID-19 or potentially contagious. Have you restricted the use of facilities to residents only? No visitors, no guests. It's one way to manage this process and make it easier. From a strata perspective, one of the things to look at is what is the cost of opening our recreational facilities? How many people will use it? It's not an excuse to not open the facility. It is a issue to take the it's an issue to take the opportunity here to look at really what the real management costs are going to be. So, you know, have we budgeted for additional janitorial cleaning, disinfecting? Do we have signage for our facilities? Do we have even the staff necessary to manage the facilities? And in many cases, strata corporations are having to hire additional staff if they want to open their pool and gymnasium facilities. I do recommend that you go to the Interior or Island Health and look at their posted guidelines for gyms and fitness centers. Now, these are prospectively commercial facilities that have gyms and fitness centers, but these provide a very good checklist for operations for users. Operations around screening and cleaning protocols and the types of material to use, access and social distancing. They help to provide a very good perspective on the degree of what you're dealing with. I think one of the questions is, how many is too many? You know, gathering in groups of 50 or more is prohibited probably for quite some time. So what it means is, if we're in a smaller strata corporation and we can social distance, can we have our annual meeting, or can we have a gathering in our hall to allow for a number of people within our community to attend? We know we can increase our personal bubble by up to 6 persons, so we're kind of like our immediate intimate family. But we also have to remember that that's one bubble that we've increased. If the other parties increase to another bubble, we've expanded that beyond those numbers. So it's the slowing of transmission that is essential, and keeping everyone healthy and safe. How does this impact our facilities, though? I think that if you look at your spaces, apply a 15% rule to your facilities. So, you know, the 2 meter rule, or 6 feet distance between parties, kind of converts into, we can only have about 15% of our gross people. If we have a meeting room and it's limited to 60 people, 15% is really only 9 people who might be able to safely social distance. And that's assuming that they are evenly spaced throughout the room and you have 2 meters in between each person in every direction. And so it is possible to safely social distance under these terms. A gymnasium, for example, if you have a larger gym, many are small, so at any given time there's only 3 or 4 people in there. But if you have a larger gym, if your gym limit is 8, 15% of that is only 1 or 2 persons, again, if they can safely social distance. If you have a hot tub and it has a limit of 6 people, 15% is 1 person. Look at the size and the space. 1 person will easily consume all of that space. Pool is not more than 10 people, for example, so a smaller pool. 15% of that is 1 person. So even though we want to open our facilities, the number of people who can use them at any given time, the screening protocols and the cleaning requirements and response by staff is incredibly significant for the benefit of 1 person. And this is where your strata corporation is going to have to weigh some decisions of economics, access, and use. Social distancing, protective masks, gloves, frequent hand washing, sanitizations, all of these isolation are all tools that are really necessary to ensure public safety and reduce transmission. Everybody gets that. I think what we're looking at for probably the next year, if not two, is the same standards to probably be maintained. It probably means we will still be doing electronic meetings to ensure that every owner has the ability to attend a meeting somehow, and has the ability to at least submit a proxy that can be restricted so their votes are protected. Are the safety protocols mandatory? Yes. As a Strata corporation, you're also an operator of a commercial pool, a gym that may be used by visitors. You have interaction with staff and contractors. You have an interactive relationship with your property managers and council members and your service providers, and they all require access to common areas and strata lots. When they're on your site, you are functioning as a business, and the safety protocols that need to be put in place for the protection of your residents, your employees, and your contractors are mandatory. So it's something to kind of step back and put in mind when you're dealing with this. Access to strata lots. Emergency response for insurance claims is probably one of the most likely and necessary functions right now. If you have a water break, even if you don't have an insurance claim, but you require emergency access. If there are water leaks in the system, if there is a fire, you have common heating and cooling systems that need to be repaired, replacement or inspection of safety systems. We still have main drainage system cleanouts that are necessary, and you have urgent repairs. It may still be necessary to access strata lots at this time. Emergency events require immediate mitigation to prevent further loss. Residents must provide access. It is an emergency. The emergency provisions under the Act and the standard bylaws still provides access in the event of an emergency. Residents must provide access, but routine service and routine inspections require owner consent. So there are a number of delays or deferrals for things like inspections of heat and smoke detectors, although those delaying provisions are short-lived because the necessity of those emergency and safety systems performing is just as important as the safety of individuals. So contact your service provider, contact Technical Safety BC, and determine what the limits are with respect to what your inspections are going to be in your buildings. However, just remember that emergency access is still required. You also have to respond to orders issued by a public authority. The Strata Corporation must comply with the order. So you could have an order that relates to a fire safety issue in your building. It may be a matter that your building annunciator that monitors your building systems needs to be replaced. That's an order the Strata Corporation must comply with. You may have a defect in your building sprinkler, an emergency response system. That's an order that can be issued. That's an order that the Strata Corporation must comply with. Without the compliance of these orders, your insurance could easily be nullified in the event of a claim. If the order requires access to a strata lot to ensure compliance, and this often goes to emergency safety systems, confirm that the strata lot number and address is also published on the order to ensure the Strata Corporation and the owner must comply with the order. This gives the Strata Corporation the ability to access the strata lot with notice in the event the owner doesn't comply with the order. So if you are involved in getting orders and it involves strata lots or a strata lot, make sure the strata lots are included on the order itself. And orders can be issued by local government, they can be issued by the fire department, by WorkSafe, Technical Safety BC, by the province, a regional health authority, for a variety of life safety numbers that can impact us. I think when we're dealing with access to strata lots, it's one of the things to consider seriously as we're deferring and delaying more and more of our inspections and our responses. Are all repairs necessary? So this is where we get into kind of splitting hairs sometimes for strata corporations. Emergency repairs are mandatory. You don't have a response. You have a duty to mitigate risk and loss in your building, protect personal safety, and protect property from future damages as well. Cosmetic repairs may be delayed if they're not a risk to health or safety. So there may have been a leak in a bathtub or a toilet from upstairs, and a ceiling downstairs may be damaged. It may all be part of an insurance claim. There may have been enough units damaged. Other than the emergency response, do the cosmetic repairs have to happen at this time? They could be delayed. Owners could delay them. Strata Corporation could delay them. It's not, if there is no risk to health or safety, they could be delayed at this point. Service inspections may be delayed provided they do not conflict with public orders. Owner contracted renovations are another issue though. They require the approval of the Strata Corporation, but they may be delayed unless they can be managed without disruption to residents, and contractor safety protocols, protection and screening are established. So, you know, in addition to the contractor who's coming in and, you know, the owners asked for just to have the apartment painted, identifying who that contractor is, establishing a visitor log, screening those contractors that are coming into the building can be a valuable tool for the Strata Corporation. It also helps to ensure that the contractors that the owners are hiring carry insurance for their purpose of being in the building, and that the contractors understand when they're in the building what their level of behavior and what their function is. Where do you get more info? We're posting a long list of links on the website and additional guides on this, but the Government of BC has probably one of the best websites across Canada when it comes to information for managing emergency orders, the medical health officer orders, the housing link for Strata. WorkSafe BC guidelines for employee safety are very well thought out, well written. All of the agencies do have contacts. If you wish to call someone, that's your other option. Your regional health authorities, we placed a direct link on the CHOA site for your region. Guides on gyms and fitness centers and local orders. The Real Estate Council have just published a checklist for strata management brokerages, which is also another good guide. It helps to understand the employee relationships and understands the employee relationship with your strata manager also. And so that is also another very good guide. So just a reminder that we've recorded this webinar and it'll be posted to the CHOA website by noon tomorrow. I'm going to pop in and look at some of the questions now and respond to some of the questions. Unfortunately, it's just me. There's nobody else to interact with this week. So bear with me for just a moment. One of the questions here is, the strata corporations who have terraces or public areas, but they're connected to their swimming pools. And so the question is, can we open our public terraced areas in connection with our swimming pools? We have a unique type of strata corporation in British Columbia where we have several strata corporations that often share facilities. And you know, one example this week is a 5 strata development, and they share a joint clubhouse, a swimming pool, a barbecue area, tennis courts, gymnasium, a meeting room that holds 100 people. So they have a very nice broad facility that they use. The difficulty is that those facilities are always on the property of one strata corporation. So it's going to be up to the strata corporation who manages or where that property is located for the most part to properly set the protocols and the management of those facilities. It is essentially on their property, even though there is some sort of covenant with the other strata buildings to be able to use the facility. It's the duty of the strata corporation who has those facilities on their property to set the protocols and to essentially make decisions. I would make those decisions in conjunction with your partnering strata corporations. I would get all the strata corporations to agree on what the protocols are going to be, what the costs may be, what may be accessible. One of the difficulties will be if your pool is not segregated and it is part of your terraced area. If the pool is operational and running, there's really no way to exclude its use and open up the terrace area. We have exactly that problem in my building. So that's something we're struggling with because we would love to be able to get people outdoors in socially distanced cubicles and pods and chairs and make that available for everyone. But our pool is integrated into the same space. So that's one of the difficulties we're struggling with of trying to determine if we can safely do this. At this time, our answer, unfortunately, is no, we don't think we can. But we're making other accommodations. We hope to do this. But when you're looking at these facilities, the problem is is very much going to be if you're looking at what that interaction looks like. And of course, looking at the transiency and use of who's actually using the facility. And that's another issue that strata corporations need to consider. And just to go back to this, I'll say it again because I think it's an important question. Is the outdoor pool in our strata considered private or public? Your pools and your strata corporations are considered to be a commercial pool. It is a commercial function and you have to comply with all of the requirements of the pool regulations under the Health Act. And so just remember that when you're doing that. And there's several questions here around pools, and they all relate to the same thing. And they all start out by saying, if our outdoor pool is considered private, it is not. Your pools are a commercial classification, and you do have to comply with any of the orders and the guidelines for pools. So start applying that, and you start to see what's taking place. So here's another facility question. A strata with a 10,000 square foot amenity center with 192 units. They have 450 residents. And how do they open a large facility with only one staff member at a time? It's impossible. You will have to hire additional staff. You have short-term rentals. You're going to have to deal with transiency and screening. If you open your pool, you're going to have to screen in the hot tub, and you're going to have to step up your protocols. You're going to have to limit the access. You're going to have to ensure social distancing. It all comes down to effectively managing this, of course, for the safety of your community and the safety for all of your residents. Summer is coming, and I'm hoping that we do have the opportunity to be able to use our pools. But in many retirement communities also that we have across the province, we have individuals, we have families that like to visit their grandparents. They may have pools or facilities. The question is going to come down to, with visitors in outside areas, are you going to allow visitors to be able to access your pools and your hot tubs? Will you step up your protocols sufficiently to be able to screen, to manage the safety and the security? Will you be able to manage the janitorial services that are necessary at the same time? If the strata has outdoor seating areas, do these areas need to be closed down as well? Not necessarily. If your strata has an outdoor terrace or an outdoor green space, set up your seating areas so that they're properly social distanced. Signage will help. Notices and communications to your owners to explain the use of the areas and the social distancing. I think that would be probably a valuable service for owners to be outside, for residents to be able to use their facilities as much as possible. And I think it's generally beneficial for the mental health of everyone involved too. If there is a piece of equipment that can be used for spraying and disinfectant that does not need wiping, it would be much easier for common areas. It would be much easier for common areas, and it would be less labor intensive. And if somebody finds a material that could be used that isn't going to leave a residue, which ultimately then increases contact, then that would be valuable to do. But again, speaking of elevators and gyms, it's not just the buttons on the doors, but there are often handrails within elevators. They need to be cleaned. The walls of the elevators need to be routinely cleaned. Don't just be satisfied to believe that somebody's doing it. Publish, and as a strata council and your property manager can help you with this, get a published protocol. How many times, how frequently are the elevators and the cabs being cleaned? How frequently are the buttons for the access in each hallway being cleaned? What cleaning protocols are being used? What cleaning products are being used? And that's information that should be made available to your owners as well. Yes, it's a much higher level of work, and it's a much greater obligation, but it is the only way to ensure that strata corporations and your communities can manage your property. Can council keep fitness rooms closed if it cannot safely be maintained? This is a strata council decision. You have to go walk through the assessment process and figure out if your strata corporation can meet all of the requirements for safety, for employees, for contractors, for anyone who uses that facility, for screening. If you can't meet all of those protocols, this may be your smartest decision, is just to simply keep the facilities closed. I don't believe that we'll be able to open our gymnasium or our pool this year for exactly those reasons. The numbers would be so restricted. Out of 250 units at any given time, only 2 or 3 people would be able to use either facility, for a significant increase in cost, cleaning protocols, and protection of staff. So while we would love to open it and we would all love to use it, it's probably not going to happen. I think one of the things to look at, and I see a number of questions with Airbnbs. One of the things to look at is with Airbnbs is the transiency, being able to identify the origin of where these people came from. I think that's one of the, perhaps one of the communications that needs to go to everyone in your building, every owner. If they still are managing an Airbnb, and we know they're still happening, we know that people are still visiting from within the province and even from out of the province. There have been reports of people visiting from out of the province as well. Is anyone screening these people? Where have they been? Have they been out of the country in the last 14 days? Do they have any of the symptoms? Have they come in contact with anyone who has COVID, tested positive for COVID-19, or may have tested positive? It doesn't take much, as we've discovered under recent circumstances, for one person to return back to the province or to visit from another province to contaminate the contagion throughout the community. It's definitely a significant issue to consider, and I think a high level of public education with your owners will help to make them aware of what they're taking down. I think I've covered almost all of the issues. Here's an interesting question, and again, there are a number of multiple communities who share clubhouses, and so things like libraries or kitchens, common kitchens for meeting rooms, Tuesday night bridge, the Friday night happy hour that traditionally people have used. I think you need to look at those with as much contemplation about the safety of the people who are using them as possible. Public washrooms and kitchens will be likely places to spread the contagion if anyone is infected. And so how do you manage those facilities in a way that are safe? At this point, it's recommended not to be using your kitchens, not to be using your refrigerators, your common water receptacles. If you can keep your public washrooms closed, that reduces your cost. But if you leave them open, then you need to increase your protocols for inspection and for cleaning and for access. And for things like libraries or lounges where people just simply go to retreat and relax. If you can ensure social distancing, and if you can provide direction to owners with respects of the handling of books or materials. I know one of the Strata corporations on Vancouver Island has provided disposable bags in their library area. They encourage people to take a book, or as many as they want, take the books home, leave them in a space for 2 days, and then read the books. And then they have a return area, where the books then by a volunteer are all wiped down, they're held in an area, and then they're put back in the library area. I know it seems over the top in a lot of ways, but BC's success rate has very much been because of isolation, because of good management of facilities, and good management of protocols. You may also want to encourage people in these areas, if there's any chance they can't social distance, wear masks. Masks are for the protection of both the person wearing it and for the other parties. And it ensures that they can't spread the virus, which is, of course, more of an issue that comes up. Does it have to be a paid staff member at a site facility like an outdoor pool, or could it be a volunteer? It could be a volunteer if the volunteer was properly trained and the volunteer was there at all times. That's the important thing. You don't want to abandon the responsibility. So one of the potentials communities are looking at to do a limited amount of access, and this may be a solution for gymnasiums or for pool areas, is they're opening up the facilities from Friday at 6 to Sunday night at 10. And that way they can either get a staff person who they can have on site, or they can get a dedicated a group of volunteers who will manage us the same way. If you have volunteers on site, make sure you've also provided them with all of their personal protection gear. Make sure that they have masks and gloves and they have sanitation equipment. Make sure they understand what questions to ask, identify the people who are going to be going through, and keep a record of the people who are using the facilities in the event there's an outbreak and there needs to be tracking of what the potential may be. So it's, again, it's about managing the public safety on every one of these fronts. Here we go back to pools for one more time. We don't have any employees. Our pool is maintained by trained volunteers. What is our liability? The liability is that while you may not have employees, your pool is still a commercial pool and must be maintained and managed in that way, and the regulations apply to the pool as well. So your liability is always the same. The first rule of Strata Corporation is no matter what happens, it's the Strata Corporation that's always sued, and it's the Strata Corporation who is 100% liable. You're the last line of defense for your owners, for your residents, for your employees, and for your contractors. So just take that responsibility seriously as you go forward. The question relating to where does the 15% number come from? If you apply a 2-meter safe zone around each individual in a space, it basically eliminates 85% of the space in your room. So when you do that, you drastically reduce the number of individuals that can be in spaces. So it roughly works out to 8 to 15%. It's an easy number that is on the, that can be calculated for spaces. I don't really have any more questions that relate specifically that go beyond any of these items. So I've covered most of them. Some of them all kind of stay in the same vein with respects to your facilities. One question I will answer though is with respects to your common room, which has a 40-person capacity, which means you can have up to 6 people and your council is 5. So can we handle observers who want to attend? You might be able to. I would inform your owners what you're going to do. I would advise owners that council will meet as a council. If you would, we can allow for an observer or give a priority to someone who is requesting a hearing on a specific matter. You could also host a conference call or a Zoom meeting at the same time and allow people to attend electronically while you hold your council meeting if that's your wish. But I think the important thing is to convey to your owners what you're doing. That seems to be the biggest challenge, is that our owners are unaware of what's taking place. And so that's, it's probably one of the greatest tools you have as strata councils and managers, is to communicate with your owners what's taking place, what's happening, how are we going to try and accommodate you. And so it's going to be a little bit more involved. I'll do with the last question, which I think is probably facing a lot of strata corporations right now because of the insurance renewals and the costs. And there are a good number of stratas that are older, and you're having to repipe your building, and you're having to get access to strata lots. This is still going to happen. I don't know that I would necessarily call this an emergency, but it is going to be a mandatory condition imposed by your insurer, which is going to compel access to strata lots to be able to do the upgrades on the plumbing. In these circumstances, I think the Strata Corporation needs to meet with owners individually through a Zoom, through a conference call, or in person if possible. Explain to them what's going to happen. You may have to, the contractor may have to isolate off areas where they are doing the connections to the strata lot itself. But you can't wait for the next insurance claim which may result in you being unable to get it to obtain insurance, or the costs becoming even more prohibitive that they are already. So it's, communicate with your owners. And again, communication solves a lot of problems in many of these units. Again, anything that's coming up with respects to facilities with respect to access to strata lots, that may be things like dryer vent cleaning, inspection of plumbing systems, drainage systems, deck inspections on balcony covers that need to be inspected on a routine basis to prevent leaks and to prevent damages. So any of these types of things that will occur within a strata lot are going to be routine maintenance items that, if deferred long enough, are going to increase your risk in your building and cause damages. Communicate with your owners on cycles, when it's possible, who's possible. If you have a contractor that may have to enter a suite, the contractor should also have personal protection gear. You, the Strata Corporation, should verify that they have actually done this, and that you can actually manage that. It's the ability for you to stay connected with your owners as much as possible. I think, well, we're through most of the questions, and we're at our time limit. So just want to wish everyone the absolute best of trying to weave through the sea of information. We certainly have come across a number of issues here. And one of the issues that we're finding is that, and we've experienced this internally through the CHOA staff, is that several questions have been sent to the same health authority with the same question from different people, and we've got back different answers on the questions. It's really difficult to get a very clear answer with respect to our pools, our gymnasiums, our public facilities within our communities. Essentially, though, they all come back to the same thing. If we can meet all of these basic protocols for staff, for volunteers, for contractors, service providers, and we can safely manage the facilities, then yes, I think you can open your facilities. But have you actually honestly met these conditions? Because they are really quite significant. The facilities requirement for swimming pools and hot tubs alone will add an enormous workload just to manage and operate them, and a significant amount of cost. So monitor those closely. And if you have any questions, we would be very happy to help you out. Next week, we're hosting a session on managing construction projects during COVID-19. The session will be focused specifically on painting and finishing on your buildings, both exterior and interior, as part of routine construction, but it's the sample that we're using. And we'll have Sat Harwood, who is a lawyer, to talk about, your contract obligations and how you manage the interaction. And we have a contractor who's going to talk about their perspective on how they access buildings for painting, for maintenance on buildings, and then if a Strata Corporation is still going forward with interior painting, the protocols that have to be managed. So it'll give you a little bit of a bird's eye view into how managing major construction will be happening. We'll have future seminars also on more invasive major construction, like electrical system upgrades, plumbing system upgrades, and those types of things that require direct interaction within strata lots and suites. Once again, thanks to Associa for being our webinar sponsor this week. We invite you to sign up for future sessions. If you have any questions, please email any one of the staff. They'll be very happy to help you. Won't be too quick right now because we are getting basically snowed with hundreds of emails every day. But thanks so much for joining us today, and all the success with your Strata managing your facilities.